Hello guys, good afternoon. Welcome back to my YouTube channel. I'm Miss Henderson. I'm a nurse educator, and today I am going to be demonstrating to my home health aid class how to properly turn and position a patient on the side. So bear in mind, these videos are meant to deepen your understanding of learning, and they are not meant to supplement your learning. So as a nurse, my job is to help students, to educate students, and help to deepen their understanding of learning and help them to pass their home health aid exam and also the CNA exam. So if you're new here to my channel, I strongly recommend that you smash that subscribe button and smash that thumbs up and drop your comments below. Thank you for my existing subscribers, those who have been subscribing to my channel. Thank you so much for your gratitude, your cooperation, and your support. It means a lot for me, and this channel is all about helping students. Let's get into our skill. So the first thing you want to do when you're going to turn and position a patient, this skill is specifically designed for patients that are bed bound. What do I mean by that? Patients that are bed bound, like somebody who maybe had a stroke or who was in an automobile accident, and somebody like they can't do anything for themselves. They are just bed bound, and you have to turn and position them on the side every 2 hours. So that being said, turning and positioning on the side will decrease the patient's incidence of developing pressure ulcers. You could call it pressure injuries, you could call it bed sores, you could call it decubitus ulcers. All these words are used interchangeably. So I have my equipments here. The equipment for this specific skill is 3 pillows, and sometimes you may need gloves depending on the patient's condition. In what situation you think I may use gloves? If a patient has like bed sores, or they have let's say cellulitis, and they have a lot of oozing of their body parts, I might have to use gloves. But if my patient's skin is intact and clean, I don't need gloves. So the first thing you want to do is that you want to knock. Hello, can I come in? Hi, good afternoon. My name is Miss Henderson, and today I'm going to be your home attendant, and today I'm here to turn you on the side. Is that okay with you? Okay, my patient said yes. Okay, I'm going to be right back. I am going to go wash my hands and gather my equipment and be right back. So you go to the sink, you wash your hands for 15 to 20 seconds. My hands are clean according to the Center of Disease Control. We're supposed to wash your hand 15 to 20 seconds. I come back. Now I have to ID my patient. Hi, you're Mrs. Jones. Hi, Mrs. Jones. What is your date of birth? She said October 4th, 1952. So I did my 2 identifiers, the patient's name and date of birth. Let's say you have a patient that is cognitively impaired. Means that maybe they have a diagnosis of Alzheimer's or dementia, and you're not able to verify that. What is another method you can verify that? By using the patient's chart. Okay. So Mrs. Jones, I am going to pull your privacy curtain to maintain your privacy and dignity. I am going to lock your bed for safety, and I'm going to raise the bed to working level to prevent back injuries. Is that okay with you? She said yes. So Mrs. Jones, what I'm going to do, I'm going to put the side rail on the other side up, so when I turn you, you can grab on the side rail for support. So have that up. My patient's skin is clean and intact, so I don't need a gloves. So I am going to lower the head of the bed, and I'm going to turn move Mrs. Jones in 3 components closer to me. Mrs. Jones, I'm going to move your body in 3 components. 1, 2, 3. I'm going to cross your leg, Mrs. Jones, and I'm going to cross your arms for proper body alignment. Mrs. Jones, on a count of 3, I am going to turn you on the side. Please hold on to the rail for proper support. The first pillow I'm going to use to support my patient's under the back of my patients. Tuck it in, supports your patient. The next pillow that I'm going to use, I'm just going to move this so you could see. I'm going to use my second pillow to place under the patient's. You have to support the knees and the legs in proper alignment. And the third pillow I am going to use is to support the hands. Then, Mrs. Jones, let me know if you're in any pain or any discomfort. Let me know. She said she's not in any pain or any discomfort. So, I'm going to cover my patient back. And when I covered my patient back, I am going to lower the bed to its lowest position. I cannot walk away from my patient if the bed is in an elevated position, because if the patient falls, the higher risk for the impact of injury is going to be severe. But if the bed is low, that's a safety measures, right? Okay, Mrs. Jones, your bed is in the lowest position. Mrs. Jones, I am going to give you your call bell right here. If you need anything, please be sure to call me if you need anything. I'm going to be back in 2 hours to turn you and position you on the other side. Is that okay with you? She said yes. I'm going to leave your call bell. You have that. The bed is in lowest position. I'm going to on-screen your safety, and I'll be back in 2 hours. I'm going to go now and clean up my workstation. Place this into the trash can. Place your side table next to your patient and wash your hands. So at this time, I'm going to say my hands are washed and my barrier is placed into the appropriate receptors. So guys, this is it for this video. Thank you so much again for subscribing to my YouTube channel. Thank you for all the support that you have been providing for me. Without you, I can't really do this, but you guys are really supporting me. You guys are really liking my videos. And please subscribe, and please drop your comments below. And thank you again for tuning in, and I'll catch you in the other video. Bye for now.